Good morning, students. Good morning. How's everything? Fine. Students, good morning. Okay. So, good morning, Nilanjana. We'll just wait for 1 or 2 more minutes till the others join in. So, focus FMG, the second part with must know MCQ. Some MCQ, some visuals. Okay, a mixed bag for you. Good morning, Ashok. So, I'm Dr. Pradeep Pawar, Professor of Anatomy, a vast experience for teaching the medical students for the entrance examination, India and abroad. Okay. Okay, now students, identify this. Identify this pointed structure. If you can identify this pointed structure here for me. What is this pointed structure here? Yes. I'll put an arrow there for you. Yes. Yes, identify this pointed structure. Anyone? First, try to identify which part you're looking at. Okay, which is this part that you're looking at. Yes, students? This is the hand, right? This is the hand. Perfect. And now what is this tendon? And what are these, what is this tendon of? Now answer. These are the two tendons, students. These are the two tendons which are going to the fingers. Anyone? These are the two tendons which are going towards the fingers on this aspect. What is this aspect? The flexor aspect, the anterior aspect or the flexor aspect of the hand. The muscle which comes here, and the tendon divides into two slips. You can see this, the tendon is dividing into two and getting inserted on either sides of the base of the middle phalanx here. Getting inserted on either sides of the base of middle phalanx. What is this? Just look at this. Look at this tendon getting inserted here on either sides of the base of the middle phalanx. Anyone? Come on, what is this tendon of? This is the tendon of Flexor Digitorum Superficialis. Flexor Digitorum Superficialis, right? And this tendon of Flexor Digitorum Superficialis, what is the origin of this muscle? It arises from the medial epicondyle of the humerus. Correct? It arises from the medial epicondyle of the humerus. It divides into 4 tendons for 4 fingers. It divides into 4 tendons. Now each tendon opposite to the base of proximal phalanx. You can see this in the slide. Just opposite to the base of proximal phalanx, it divides into 2 slips. It divides into 2. ऐसे those slips में divide होता है ये. Each tendon divides into 2 slips and this is inserted on the base of the middle phalanx. Correct? That's the middle phalanx. Inserted on the base of middle phalanx. So students, you tell me, this flexor digitorum superficialis is going to act on all the joints that it has crossed. What was the origin? Medial epicondyle of the humerus. So first joint which it crosses is the elbow joint. What is it going to do to the elbow joint? Flexion at the elbow joint. Second, it crosses the wrist joint. So flexion at the wrist joint. Third, it crosses this joint. What is that? Metacarpophalangeal joint. So that's flexion at the metacarpophalangeal joints and flexion at the proximal interphalangeal joints. Okay, flexion at proximal interphalangeal joints. Is the flexor digitorum profundus going to act on the distal interphalangeal joints? No, it is not going to act on the distal interphalangeal joint because it is inserted on the base of the middle phalanx. Base of the middle phalanx. Clear? Now, what is this tendon? Students, if you can quickly tell me, students, what is this tendon of? I just mark that for you. Yes, what is this tendon? Now this is the tendon which goes through the split. It passes through the split of superficialis and it goes and gets inserted into the base of the distal phalanx, the base of the distal phalanx of the fingers. What is that? Flexor digitorum profundus. Flexor digitorum profundus. So which muscle is going to flex the distal interphalangeal joint? The flexor digitorum profundus. Clear? Flexor digitorum profundus is going to flex the distal interphalangeal joints. Students, quickly tell me, what is the nerve supply of flexor digitorum superficialis? Anyone? Nerve supply of flexor digitorum superficialis. Bolo, bolo, whatever you know, you answer, students. Whatever you know, you answer. That's fine. Even if it is wrong, it's okay. What is the nerve supply of flexor digitorum superficialis? That's a medial nerve. Medial nerve. And flexor digitorum profundus has got a dual nerve supply. Double nerve supply. The medial half of profundus is supplied by a branch of medial nerve. Anyone? What is this nerve? The medial half of profundus is supplied by a branch of medial nerve, and that is the deep branch of medial nerve. Anyone? Can you answer this? No, bacha, no. Ajit, no. Profundus, I'm talking. Profundus. The medial half. Acha. The medial half is supplied by ulnar nerve. Yes. And the lateral half, I'm so sorry. The lateral half is supplied by a deep branch of medial nerve. Yes, it supplies the lateral half of profundus. What is that nerve? Yes, yes, yes. Yes, Ajit, that's right. So medial half of profundus is supplied by ulnar nerve, and the lateral half is supplied by the anterior interosseous nerve. Anterior interosseous nerve, correct. Okay, that's about the first slide, anterior interosseous nerve. And students, if you can quickly tell me, see, what is this number 1 and what is this number 2? You get such visual slides in the exams, huh? What is this number 1? Can anyone help me to identify this number 1? Boliye, boliye, boliye. Number 1. Number 1 is, these are the muscles of thenar eminence. I'm giving you a hint. Chalo, now you answer. This is a muscle of thenar eminence. There are 3 muscles in the thenar eminence, correct? Those superficial hote hain, and you remove this, one is deep. So the first one, which is lateral, it is going to take the thumb out. What is this? Abduction. Yeah, abduction. So this is the abductor of the thumb, abductor of the pollicis, name. And these are small muscles, muscles of the hand. These are small muscles. So what do you call this muscles as? Brevis. Chote muscles hote hain, brevis. So what is the name of this muscle? The first lateral muscle. It's abductor pollicis brevis. Abductor pollicis brevis. And number 2, the second muscle is going to take the thumb down like this. Down. What's this? Flexion. Muscle ka naam flexor pollicis brevis. Flexor pollicis brevis. Okay. And if you remove these 2 muscles, the third muscle is going to do this. What is that? Opposition. Name of the muscle? Opponens pollicis. Opponens pollicis. Is this clear to all of you? And these 3 muscles of the thenar eminence are supplied by whom? Medial nerve. Yes, correct. These 3 muscles of the thenar eminence are supplied by medial nerve. Look, students, I'll just go further and we will discuss about. We'll discuss about this. 1 minute. I'll just come to the screen, white screen. Chalo. We'll quickly discuss the movements of the thumb. Movements of the thumb. So the first movement of the thumb is abduction. Movements of the thumb. The first movement of the thumb is abduction. If you can quickly tell me abduction of the thumb. Who does abduction? See, all your concepts will be clear. We are discussing movements of the thumb. Okay? Abduction. Chalo, answer now. Students, come on. Everything is going to be clear. You answer whatever you know. Be interactive. So, abduction. This is abduction of the thumb. Abduction of the thumb is done by 2 muscles. Yes. Quickly, answer. The first muscle is abductor pollicis brevis. ये मैं short में लिख रहा हूँ. I'm writing in short. Abductor pollicis brevis. दूसरा है abductor pollicis longus. Abductor pollicis brevis. Abductor pollicis longus. Nerve supply of abductor pollicis brevis. Anyone? Abductor pollicis brevis is a muscle of thenar eminence. Bachcho, it's a muscle of thenar eminence. Nerve supply. Medial nerve. Medial nerve. And abductor pollicis longus is a muscle, deep muscle of the back of the forearm. Deep muscle on the back of the forearm. Abductor pollicis longus. Can anyone tell me the nerve supply of this muscle? Come on, students. Anyone can tell me the nerve supply? Can anyone tell me the nerve supply? Abductor pollicis longus. No, medial nerve nahi bacha. It's backside. Look, it's behind, my child. I'm telling you, this is backside. And the nerve which supplies the complete extensors of the arm and the forearm. Which nerve is that? Ulnar nahi. No, not ulnar. Ulnar and medial nerve are on the anterior aspect. No, they are supplying the anterior aspect of the forearm. Which is the nerve which supplies the posterior aspect of the forearm and the posterior aspect of the arm? Radial nerve. Radial. And this abductor pollicis longus is supplied by a deep branch of radial nerve. Can anyone answer this? Deep branch of radial nerve is known as posterior introosseous nerve. Introosseous nerve. Posterior introosseous nerve. जैसे anterior introosseous nerve, you know, anterior introosseous nerve is a deep branch of medial nerve. Yes, exactly. So you've got posterior introosseous nerve, which is a deep branch of radial nerve. ठीक है? So clear, बच्चों? Abduction of the thumb is done by abductor pollicis brevis and abductor pollicis longus. Okay, we come to the next. Adduction of the thumb. Can anyone answer this? Adduction of the thumb is done by whom? Chalo, answer students. Be interactive. Let it be an interactive session. Adduction of the thumb is done by whom? Anyone? I'm looking down at the screen what you're answering. Adduction of the thumb. Bolo, 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 bacho. So one is adductor pollicis. Adductor pollicis does adduction of thumb. Any other muscle doing adduction of the thumb? First palmar introosseous. Very good, very good. Adductor pollicis and the first palmar introosseous. Just try to understand this. There are plenty of MCQs which comes on this topic. Okay, so just have an overall orientation, students, and try to be interactive. So adductor pollicis is supplied by whom? Can anyone answer this? Adductor pollicis. It's supplied by the nerve which supplies the maximum number of muscles in the hand. The major muscles in the hand. Who's that? Who's that? Ulnar nerve. Yes, ulnar nerve. Adductor pollicis is supplied by ulnar nerve. And the first palmar introosseous is also supplied by ulnar nerve. Ulnar nerve. So एक abduction हो गया, adduction हो गया. Very good my child. Third is flexion. Flexion of the thumb. Anyone? Chalo. Flexion is this, like this, like this, like this. That's flexion. Yes, that's flexion of the thumb. And the flexion of the thumb is done by one, the flexor pollicis brevis, flexor pollicis brevis, and flexor pollicis longus. Flexor pollicis brevis, flexor pollicis longus. Flexor pollicis brevis का nerve supply. Can anyone tell me? उसके दो heads है. One is the deep head and one is the superficial head. Superficial and deep head. है ना? दो heads है ना flexor pollicis brevis के. So the superficial head is supplied by whom? Median nerve. Very good, very good, very good, Nirupam. Very good. The superficial head is supplied by median nerve, whereas the deep head is supplied by ulnar nerve. Ulnar nerve. It's a composite muscle. Remember, students, it's a composite muscle. So the next thing we'll discuss is composite muscles of the upper limb. Yes, 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 yes. So this is how we proceed into the topic. You answer accordingly. I'll proceed further. So flexor pollicis brevis has got a deep head and a superficial head. Superficial head is supplied by median nerve and the deep head is supplied by ulnar nerve. And flexor pollicis longus would be supplied by anterior introosseous nerve. Anterior introosseous nerve is a deep branch of median nerve. Anterior introosseous nerve, that's a deep branch of median nerve. Clear to all of you? So that's about flexion. Next is extension of the thumb. Extension. And this extension of the thumb is done by whom? Extensor pollicis longus and extensor pollicis brevis. Extensor pollicis longus, extensor pollicis brevis. ये सब muscles कहाँ होता है? All these muscles are present on the posterior aspect, the dorsal aspect of the forearm. ये जो abductor pollicis longus है, extensor pollicis brevis है, extensor pollicis longus, students, all these muscles are present where? On the dorsal aspect of the forearm. And incidentally, these three muscles are going to form the snuff box. है ना, ये जो abductor pollicis longus था, extensor pollicis brevis and extensor pollicis longus, these three muscles are going to form what? The snuff box. Can anyone answer this nerve supply of extensor pollicis longus and extensor pollicis brevis? That's a posterior interosseous nerve. That's a branch of radial nerve. ठीक है, radial nerve. So then, abduction is over, adduction is over, flexion is over, extension is over. Which is the last opposition? Opposition of the thumb is done by whom? Opponents, Pollicis, and this is supplied by medial nerve. Opponents pollicis is a muscle of what? Thenar eminence. It's a muscle of thenar eminence. Okay, so that is supplied by medial nerve. Any doubts, students, in this? Any doubts? This should be perfect. Perfect. Plenty of MCQs that you get on this topic. Movements of the thumb. Okay, so look here once again, movements of the thumb. See, what was this for the fingers, students? What is this for the fingers? This, flexion. What is this for the fingers? Extension. What is this for the fingers? This, abduction. And what is this for the fingers? This, adduction. Okay, so that's flexion, that's extension, that's abduction, and that's adduction of the fingers. Now, the thumb, the first metacarpal bone, the thumb is not in line with the other fingers. ऐसे नहीं होता ना, it's not in line. The first metacarpal bone is rotated by 90 degrees. ऐसे, it is turned medially by 90 degrees. So, the movements of the thumb would be at right angles to this fingers, right? Movements of the thumb would be at right angles to this finger. So now you tell me, students, if that's flexion and if that's extension, what is this? If this is flexion and this is extension for the fingers, for the thumb at right angles? Yes, this is going to be flexion and this is going to be what? Extension. If this is abduction and adduction for the fingers, for the thumb at right angles, this is going to be abduction. This is going to be adduction. And what is that? Opposition. So these are the movements of thumb. Clear, students? So this is flexion, this is extension, this is abduction, this is adduction, and that's opposition. Okay. Quickly, tell me now. If there's a carpal tunnel syndrome, I'm telling you the MCQ now. Look, if there's a carpal tunnel syndrome, which movement at the thumb would be lost? Now you answer. If there's a carpal tunnel syndrome, students, which movement at the thumb would be lost? Which movement at the thumb would be lost? Now I've given you a complete chart of movements of the thumb with the nerve supply. So if there's a carpal tunnel syndrome, which movement of the thumb would be lost? Carpal tunnel syndrome means which nerve? Which nerve is involved in the carpal tunnel syndrome? Medial nerve. Here. Compression of the medial nerve in the carpal tunnel. That's carpal tunnel syndrome. Which muscle, which movement would be lost? Anyone? Opposition. Perfect. Perfect. Opposition would be lost. Opposition would be lost. Why? Because there are other muscles everywhere which are supplied by the nerves other than medial nerves. Like see, flexion, abduction. Sorry, abduction is done by abductor pollicis brevis. If there is compression of medial nerve, carpal tunnel syndrome, abductor pollicis brevis is gone, paralyzed. But abductor pollicis longus intact hai na, which is supplied by radial nerve, posterior interosseous nerve. So abduction is still possible. Adduction though no question at all. It is supplied by ulnar nerve, so no problem at all for adduction. Flexor pollicis brevis, the superficial head is supplied by medial nerve, and flexor pollicis longus is supplied by anterior interosseous nerve. But where? Anterior interosseous nerve supplies the flexor pollicis longus in the forearm. Forearm में supply करता है. So if the nerve is injured in the carpal tunnel, इसको कुछ नहीं होगा. This will be spared, no बच्चों. This will be spared. if the nerve is involved in the carpal tunnel, everything distal to this will be involved. So the hand will be involved. Flexor pollicis longus will be spared. समझ में आ रही है? Are you following this? So there is no problem for flexor pollicis longus at all. This is going to be intact. And this ulnar nerve is there, so this will be intact. Extension, no problem at all for extension because supplied by posterior tertius nerve. So this is going to be intact. Ab, which movement would be lost? Opposition. Why? Because opposition is done by opponent's pollicis muscle, and this opponent's pollicis muscle is only supplied by medial nerve. So opposition is lost. Is this clear, students? Are you all following this? Perfect. This should be. I've given you the complete flow chart with the movements, with the muscles producing movements. This has to be perfect. Okay, nobody will be getting such a chart where everything is given under one roof. So just remember this. Chalo, now this is over. Tell me the composite muscles in the body. Composite muscles. If anyone can answer this, composite muscles in the body. Composite muscles in the body. One. And yeah, start. Composite muscles in the body. So let me finish this, then I come to the MCQs once again. We're starting with upper limb. We start with pectoralis major. Anyone can tell me the nerve supply of pectoralis major? Come on, students. Composite muscles. Composite. It is also known as hybrid muscles. Composite or hybrid muscles. So pectoralis major is supplied by medial and lateral pectoral nerves. Medial and lateral pectoral nerves. Whereas nowadays we include the pectoralis minor also. See students, first we used to say pectoralis minor is supplied by whom? Medial pectoral nerve. This is what we initially used to say. Pectoralis minor is supplied by the medial pectoral nerve. Why? Because the medial pectoral nerve is going to pierce the pectoralis minor. This is what the reason was. The medial pectoral nerve pierces the pectoralis minor and goes and supplies the major. Okay. Right. So nerve supply, the nerve supply what we were talking about is the medial pectoral nerve supplies the pectoralis minor. Now it is said that the lateral pectoral nerve also supplies. Okay, so pectoralis major, so that I'm not writing for now. Second is brachialis. Brachialis. Now it is said pectoralis minor is also supplied by medial and lateral pectoral nerves. Just remember that, keep in mind. Brachialis कैसे divide करते हैं इसको? Medial half. So this all things will be clear to you. Medial half of brachialis and the lateral half of brachialis. Medial half, lateral half. Medial half is supplied by whom? Anyone? That's the musculocutaneous nerve. And the lateral half will be supplied by radial nerve. Musculocutaneous nerve supplies the medial half of brachialis and the lateral half is supplied by radial nerve. The next muscle is flexor digitorum profundus. Again, medial half and lateral half. You've just answered this, students. The medial half of profundus is supplied by ulnar nerve, yes, and the lateral half is supplied by the anterior interosseous nerve. Anterior interosseous nerve. Then comes the flexor. I'll write in short. Flexor pollicis brevis. Flexor pollicis brevis. This is supplied again by two nerves. One is the superficial head and the other one is the deep head. Superficial head is supplied by the medial nerve and the deep head is supplied by the ulnar nerve. Okay, so superficial head of flexor pollicis brevis is supplied by medial nerve and the deep head is supplied by ulnar nerve. Clear to all of you? So that's about the composite muscles of the upper limb. I'm giving you a chart like this, so remember this. Pectoralis major, in sequence we are going pectoralis major, then brachialis, then flexor digitorum profundus and flexor pollicis brevis. Flexor pollicis brevis के दो heads है, superficial, deep. Superficial is supplied by medial nerve, the deep head is supplied by ulnar nerve. Okay, coming to the muscles of lower limb. बोल सकते हैं? Pectineus. Pectineus, medial half, and lateral half. Anyone? Can you tell me who supplies the lateral half of pectineus? Anyone? Come on, students, come on. Lateral half of pectineus is supplied by femoral nerve. And the medial half of pectineus is supplied by obturator nerve. Of which part of obturator nerve I'm not telling you. Just the obturator nerve, the lateral half is supplied by femoral nerve. बस इतना याद रखना अब के लिए. Any other muscle? Pectineus. Next is adductor magnus. Adductor magnus muscle. कैसे लिखोगे इसको? Adductor part and the hamstring part. Hamstring part is present in the posterior compartment, right? So hamstring part of adductor magnus is supplied by whom? Anyone? That's the tibial part of sciatic nerve. And the adductor part is supplied by posterior division of obturator nerve. So I've written it like that for you. So adductor magnus के दो parts होते हैं. One is the adductor part. Adductor part is present in which compartment? Anyone? Adductor part of adductor magnus is present in the medial compartment. And the adductor compartment, that's medial compartment. The nerve supply, posterior division of obturator nerve. And the one which is present in the posterior compartment, that's the hamstring part. Hamstring part of adductor magnus is supplied by the tibial part of sciatic nerve. That's adductor magnus. And the last one is biceps femoris. Long head and short head. Long head is supplied by the tibial nerve, and this is supplied by the common peroneal part of sciatic nerve. Yes, common peroneal part of sciatic nerve. Okay, that's it. I hope this is clear to all of you. बच्चों कुछ डाउट्स है तो बोलो. Biceps femoris के दो heads हैं. One is the long head, one is the short head. The long head is a hamstring. That is why we include the long head in the hamstring, students, because it is supplied by the tibial nerve and the rest of the characteristics are there. The short head is not a hamstring. Why? Because it is supplied by the common peroneal part of sciatic nerve. Perfect है बच्चों? Perfect. No doubts, no confusions in this. Huh? You get MCQs on this. I've given you a complete flow chart for this. Yes, I've given you a complete flow chart for this. Right. So now coming to the next one. If you can answer this, students. So some MCQs, some theory, it's a mixed bag type of thing. But yes, you should know this. You must know this. So I put it in a must know topic. A 60-year-old male was diagnosed as C8 testis, the carcinoma testis. An orchidectomy was planned. The surgery resident was recollecting the lymphatic drainage of the testis. Testis drains into which of the following lymph nodes? Extremely important MCQ. Yes. Para-aortic. Perfect. Very good, bacha. Para-aortic lymph nodes. Bhanu Prakash, yes, it drains into the para-aortic group of lymph nodes. Remember, the gonads, the testis and the ovaries, both, they drain into para-aortic lymph nodes. Not the testis and the ovary drains into para-aortic. Nahi bacha, inter-iliac nahi, it's para-aortic lymph nodes. Testis and ovary both drain into para-aortic lymph nodes. Okay? And then I'll just tell you this. One moment. This is another thing which you have to know. But look, there are certain things which you should know. There is no compromise in this. Now tell me, ये जो superficial inguinal lymph nodes होते हैं, they are in the form of a T, है ना? ऐसे T-shaped होते हैं, T-shaped. They are in the form of a T-shaped, ऐसे T. So this is the medial group. and this is the lateral group, medial group, lateral group. This is the horizontal group of lymph nodes. Horizontal group mein you have got the lateral and the medial group, and this is the vertical group. Vertical group. So superficial inguinal lymph nodes is in the form of a T. This is the horizontal group, and this the limb of the T is the vertical group. So horizontal group mein you've got two parts, a medial and a lateral. So you've got upper medial, upper lateral, and the vertical group. So what drains into the upper medial? Anyone can answer this? Upper medial group. This is very, very important. You have to know this. Upper medial group. Chalo bacho, if you can answer this, upper medial. Who drains? 1. Yes, yes, yes. What did you know? You answer no. You answer, that's okay. Upper medial group. It drains the anterior abdominal wall. It drains the anterior abdominal wall below the umbilicus. Anterior abdominal wall below the umbilicus. Skin and fascia of the perineum. Skin and fascia of the perineum. Perineum, you know, perineum. Perineum is that diamond-shaped structure seen in lithotomy position. If the person is in lithotomy position, that area is known as perineum. That we'll see later. Huh? Skin and fascia of the perineum. Ye clear hai na? I'll write this P-E-R-I-N-E-U-M. Okay, so it drains the skin and the fascia of the perineum, including external genitals. Except the glans penis and the glans clitoris. Glans penis and glans. This is very important. इसमें भी बहुत बार MCQ आता है. Look, it drains the entire perineum. It drains the entire perineum, the skin and fascia of the perineum, including the external genitals. Including external genitals, except the glans penis and the glans clitoris. Can anyone tell me the glans penis and glans clitoris drains into what? This is another very important MCQ. The glans penis and the glans clitoris drains into the deep inguinal lymph nodes. Deep inguinal lymph node. That's lymph node of Cloquet. Yes, you got this. Lymph node of Cloquet or Rosenmuller. Yes, yes. What you're thinking is absolutely right. The lymph node of Cloquet or Rosenmuller drains what? The glans penis and the glans clitoris. That's a deep inguinal lymph node. Remember, bacho, that's a deep inguinal lymph node. Baki, the entire external genitals drains into which lymph nodes? Superficial group of lymph nodes. Third, penile part of male urethra. Penile part of male urethra. Okay, next, it drains anal canal below. Can anyone answer this? Anal canal below. Yes, you answer this. Anal canal below. अरे बच्चा इंटरनल जेनिटल है ना, टेस्टिस छोड़ के बाकी सब है ना बच्चा. Look, you leave the testes, then you've got epididymis, vas deferens, seminal vesicles, ejaculatory duct. These है ना, this will drain into internal iliac lymph nodes, है ना. Testes, see the entire genital system of males, drains into interiliac except the testes, the ones which is inside the abdomen. The testis would drain into para-aortic lymph nodes. बाकी जो भी है testis, after the testis you've got epididymis, vas deferens, seminal vesicles, ejaculatory duct, है ना. So all this would drain into internal iliac lymph nodes. Understanding, Prem? And external genital है ना, the scrotum, the skin over the penis and all, this will drain into what? Superficial inguinal lymph nodes. The glans penis and clitoris drains into deep inguinal lymph nodes. I hope I have answered your query. Prem, is this correct? Right? Yes. So anal canal below. Yes, answer this. Anal canal below. Dentate line. Dentate or pectinate. Yes, if you have any doubts, you please ask. You should be absolutely clear. No doubts in your mind. The anal canal below the dentate or pectinate line. So anal canal above the dentate line hoga na, dentate line that will be into internalia. Below the dentate line, the anal canal drains into the superficial inguinal lymph node. Superficial inguinal. This is very important because cancer hota hai below the dentate line. No. The dentate line is also the watershed line. Uske niche the nerve supply is also different. The nerve supply below the dentate line is somatic nerve, somatic. So it is subjected to pain. Pain hota hai and all. That's below the dentate line. Above the dentate line, that's autonomic, insensitive to pain. Correct. Vagina below the hymen drains into superficial inguinal lymph nodes, and then is superlateral. I'm so sorry, superlateral. Angle of the uterus. Superlateral angle of the uterus, it is also known as cornu of the uterus. Cornu of the uterus. So this, students, this is extremely important for you. This you should know. Matlab, there's no option. You have to know this. So what drains into the upper medial group? The anterior abdominal wall below the umbilicus, skin and fascia of the external genitals, including skin and fascia of the perineum, including the external genitals, except the glans pallis and clitoris, the penile part of male urethra, the anal canal below the dentate line, vagina below the hymen, and the superlateral angle of the uterus. Superlateral angle, समझते हो? ये देखो, I'll just draw this for you. ये uterus है. That's the fallopian tubes. That's the fallopian tubes. So the point of attachment of the fallopian tubes to the body of the uterus, this is known as the cornu of the uterus. Cornu, or this is also known as the lateral angle of the uterus. Lateral angles of the uterus. This is clear to all of you, bachon. So this is the upper medial group. Now coming to the upper lateral group. Upper lateral group. Upper lateral group. So what is the upper lateral group going to drain? It drains the back below the umbilicus. Back below the umbilicus. The gluteal region. Gluteal region, skin and fascia on lateral aspect of the thigh. Skin and fascia of the lateral aspect of the thigh and the gluteal region. So it drains basically the back below the umbilicus. Umbilicus is a watershed line because umbilicus ke upar or niche everything is different. The nerve supply, the blood supply, the lymphatics, everything is different. So back below the umbilicus drains into what? The upper lateral group of lymph nodes, skin and fascia of the lateral aspect of the thigh, the gluteal region. The gluteal region, okay. All this is going to drain into the upper lateral lymph nodes, upper lateral lymph nodes. Okay, and vertical lymph nodes drains the lower limb. Lower limb drains into the vertical lymph nodes. Vertical lymph nodes is going to drain the lower limb. Okay, bachcho, clear to all of you? Okay, now we proceeding to the next MCQ. Children, come on, identify this. What is this that I'm pointing at? Anyone? What is this that we're pointing at? Come on, students, answer. Even if it is wrong, it's okay. When you make a mistake, you tend to understand things. You tend to know new things, okay? So always give it a try. Don't hesitate. And even if it's a mistake, do not retract your messages. That's okay. No one's going to see this except you and me. Come on, students, tell me, what is this pointed structure? Anyone? बोलो ना बच्चों, बोलो. This is a section of the face, है ना? Section of the face like this. It's a section taken like this, sagittal section. Oropharynx, Dr. Rahul, something, oropharynx neck. This is the one which is going to close the nasopharynx from the oropharynx. Now you tell. This is something which is closed, which will close while having food, while having water. The water doesn't come out through the nose, right? The water doesn't come out of the nose because this is the thing which is going to separate the nasopharynx from the oropharynx. Yes, that's a palate. Very good. And what palate is that? What palate is that? Bacho, look, students. This is the hard palate, right? This is the hard palate. So what is this? This is going to be the soft palate. This is the soft palate. Students. This is going to be the soft palate. Soft palate. Okay, that's a soft palate. And this hanging thing in the center is the uvula, the one which hangs when we do an and the thing which hangs in the center is known as uvula. Chalo bachcho, now you quickly tell me what are the muscles of the soft palate, and I want you to know the nerve supply of them. That's extremely important for you. Come on, students. The muscles of the soft palate. Come on, if you can just enumerate these muscles for me. Answer, bachcho, answer. One muscle begins from the palate and goes to the tongue. Name. From the palate to the tongue. It's palatoglossus. Perfect. From the palate to the epiglottis. From the palate to the pharynx. Yes, that's soft palate. That is soft palate only. From the palate to the pharynx. Anyone? That's the palatopharyngeus. Yes. Now one muscle is going to tense the palate. It is going to tense the palate. Name? Tensor palate. Tensor palate. The other muscle is going to elevate the palate. Elevate. Name? Levator palate. Levator palate. And the last muscle which hangs in the center, it hangs in the center, musculus uvulae. It hangs in the center, that's musculus uvulae. Okay, so these are the muscles of the soft palate. An extremely important thing for you to know. Very important MCQ, students. So palatoglossus, palatopharyngeus are tensor of the palate, tensor palate, and elevator of the palate, the levator palate, and the musculus uvulae. So all these muscles would be supplied by anyone on the nerve supply of this. All these muscles are supplied by pharyngeal plexus. Pharyngeal plexus, also known as vagoaccessory complex. So all these muscles are supplied by pharyngeal plexus except it is also known as vagoaccessory complex, except tensor palate, which is supplied by mandibular nerve. Tensor palate, which is supplied by mandibular nerve. So you have to know the muscles of the soft palate and the nerve supply of the muscles of the soft palate. So all the muscles are supplied by pharyngeal plexus except the tensor palate, which is supplied by mandibular nerve. Okay. Coming back to this MCQ. Now, what is this? What is this muscle? I'll put a star for you. Yo. Yes, students, answer. What is this muscle? Plenty of things in this slide. बहुत है इसमें to understand. Chalo, answer. You be quick. I'll go faster. What is this muscle which begins from? ये कौन है? ये देखो, ये कौन है? Mandible, है ना? This is the mandible, right? So this is the muscle of the tongue which begins from the mandible and goes to the tongue. Anyone? What is this? Genioglossus. Yes. And what is the nerve supply of genioglossus? The nerve supply of genioglossus is hypoglossal nerve. Hypoglossal nerve. So genioglossus and hypoglossal nerve. Anyone, can you identify this? What is this pointed structure? The one which you have pointed, the one which lies behind the tongue. What's that? The one which is lying behind the tongue. Come on, come on, come on, students, come on. What is that structure which lies behind the tongue? Anyone? This is the epiglottis. This is the epiglottis. Epiglottis. Yes, excellent. That's the epiglottis. I want the nerve supply of epiglottis. Anyone? The nerve supply of epiglottis? Yes, Balu has identified it. Nirupam has identified it as epiglottis. Very good, very good. Can you tell me what is the nerve supply of epiglottis? If you can answer this. Epiglottis is derived from. Come on, come on, come on, students. Polo. Epiglottis is supplied by what? Nerve supply. Nerve supply of epiglottis. See, if you unpaired midline cartilage, that's fine, no, bacha. I'm asking you the nerve supply. Nerve supply what? I want the nerve supply. So you have to know this, and these things are extremely important. Extremely important. So now, look quickly. I'll give you an orientation. We are taking a section from the neck like this, essay. We're taking a section like this. What is that section? A coronal section. Coronal section of the neck. So what is this from outside? This is ectoderm, and this depressions are known as ectodermal clefts. ये अंदर से होता है endoderm. हम इससे बोलेंगे endodermal pouches. These are endodermal pouches, and these are the ectodermal clefts, and clefts. So I've taken a section. This is of one side and this is of one side. From outside, this is the skin. So what is this? Ectoderm. From inside, no, that's a mouth. So that's a GIT. From inside is the GIT, and from inside it is endoderm. And ye under side, this is the GIT. So that's endoderm. Outside is ectoderm, and in between is the mesoderm. ये बीच में होता है mesoderm. So I've taken a section like this. That's the section there. Now we join this, and what is this? This becomes one pharyngeal arch, the second pharyngeal arch, the third pharyngeal arch, the fourth pharyngeal, the sixth pharyngeal arches. So these are the pharyngeal arches. Clear, students? So what I want you to understand is each pharyngeal arch from outside is lined by what? Ectoderm, and from inside would be lined by endoderm. Now, if you can quickly tell me, in the first pharyngeal arch, we get two. Oh my God, this is gone. One moment, bacho. Just give me 2 minutes. No, this just goes off if the screen is changed. These are ectodermal clefts here once again, and these are the endodermal pouches. Just give me 2 minutes. Endodermal pouches here, and these are the ectodermal clefts. So we join this. This becomes the pharyngeal arches. Okay? In the first pharyngeal arch, we get two swellings here. If you can answer this, what are these two swellings known as? इनको हम बोलते हैं lingual swellings. And there's something behind which is formed here, and this is what we call as the tuberculum impar. Yo, that's tuberculum impar. ये maxillary nerve नहीं है बच्चा, प्रेम. It's not maxillary. You are wrong. That's mandibular nerve. Mandibular nerve. So two lingual swellings and one tuberculum impar. They are going to form what? Children, students, what are they going to form? The anterior 2/3 of the tongue. Derived from two lingual swellings and tuberculum impar. Forms the anterior 2/3 of the tongue. Which arch is it formed? First arch. Which is the nerve of the first arch? Mandibular. So anterior 2/3 of the tongue is supplied by a branch of mandibular nerve. That's lingual nerve. Okay? Now in the third and the fourth arches you get a prominence here. इसका नाम है Hyperbarical Eminence. hypobranchial eminence, it is also known as the cupula. Cupula, hypobranchial eminence or cupula. It divides into two parts. It divides into, this is the cranial part, yes, cranial part, and this is the caudal part of the hypobranchial eminence. Matlab cranial part lies in which pharyngeal arch? Third. And the cranial part of the hypobranchial eminence is going to form the posterior 1/3 of the tongue. Posterior 1/3 of the tongue is derived from the cranial part of hypobranchial eminence. Cranial part. Which is the nerve here? Which is the nerve of the third arch? Glossopharyngeal nerve. Glossopharyngeal. So who supplies the posterior 1/3 of the tongue? Glossopharyngeal nerve. Posterior 1/3 of the tongue is therefore supplied by glossopharyngeal nerve. And look students, look, what is this now? This is the caudal part. And this caudal part of hypobranchial eminence hai, and this caudal part is going to form the posterior most part of the tongue. Students, posterior most part of the tongue. And here, what's this? Epiglottis. So posterior most part of the tongue and epiglottis is supplied by the nerve of the fourth arch. Which is the nerve of the fourth arch? The nerve of the fourth arch is superior laryngeal nerve. Superior laryngeal nerve. Now superior laryngeal divides into an external laryngeal nerve and an internal laryngeal nerve. The external laryngeal nerve is motor, supplies the cricothyroid muscle. It's motor, no? So supplies the cricothyroid muscle. Now, yes. So now the fourth arch is superior laryngeal. Superior laryngeal, see, moment superior laryngeal comes to your mind, remember, the superior laryngeal divides into an external and internal laryngeal. The external laryngeal nerve is a motor nerve. So what is it going to supply? The cricothyroid muscle. अब ये जो internal laryngeal nerve है, this is sensory, बच्चों, this is sensory, and this sensory nerve is going to supply what? Yes, the posterior most part of the tongue and the epiglottis. This is supplied by the internal laryngeal nerve. Is this clear? The posterior most part of the tongue and the epiglottis is derived from the fourth pharyngeal arch. The nerve is superior laryngeal nerve. It is therefore supplied by a branch of superior laryngeal. That's the internal laryngeal nerve. I hope I am clear to all of you. This is the sensory nerve supply of the tongue. See, we were discussing epiglottis. Students, we were discussing epiglottis. To understand the nerve supply of epiglottis, I have told you the entire pharyngeal arches. And with that, I have explained you the nerve supply of tongue also. And I have given you the embryological basis of nerve supply. Why the anterior 2/3 is supplied by lingual nerve? Because it is derived from first pharyngeal arch, from two lingual swellings and tuberculum impar. The posterior 1/3 is derived in the third pharyngeal arch from the cranial part of hypobranchial eminence, also known as cupula, so glossopharyngeal. And the posterior most part of the tongue and the epiglottis is supplied by internal laryngeal nerve. No controversy on this, nothing to think about. That's internal laryngeal nerve. That is what should be known to you. And what is the external laryngeal nerve supply? ये motor होता है. External laryngeal is motor, so it is going to supply the cricothyroid muscle. Cricothyroid, ठीक है? So that's motor. अब ये ना structure बनता है tongue का. So structure of the tongue is derived in the pharyngeal arches. In the pharyngeal arches, that's the structure of the tongue derived. The muscles of the tongue are derived from. Can anyone answer this? The muscles of the tongue are derived from what? The muscles of the tongue come from the occipital regions, and this is derived from the occipital myotomes. So muscles of the tongue are derived from occipital myotomes, and that's how the hypoglossal nerve comes to supply the tongue. Hypoglossal nerve comes to supply the tongue because the muscles of the tongue are derived from occipital myotomes. Okay, clear to all of you? So muscles of the tongue are derived from occipital myotomes. Second pharyngeal arch का nerve is facial nerve बच्चा, facial nerve. प्रेम किशोर, which are the nerves of the pharyngeal arches? The first arch is mandibular nerve. The second arch, the nerve is facial nerve. The nerve, the third arch is glossopharyngeal. The nerve, the fourth arch is superior laryngeal nerve. Sixth arch, recurrent laryngeal nerve. This you should know. Okay. This you should know. Clear, students? So before we proceed to the next MCQ, I'll just quickly brief you about our platform. Okay, I'll just quickly brief you about our platform. So students, we've got a plus subscription in which there are daily live classes, live quizzes, learning from the top educators, study on the device of your choice, and access to over 25,000 plus question banks. Okay, questions from the question bank. And now students, we are coming up with printed notes for our 12 months and plus subscription students. We are coming with printed notes for them. An iconic subscription, students, where you get the best of Unacademy and pre-platter. Now, special class features in which there are interactive live classes, special poll for the learners, raise a hand technique in which there's an icon. If you press this icon, you can directly talk to the educator. Never miss a class with proper notifications being given to all, and lecture notes you get, and anywhere, anytime you can access the class and get your doubts solved. Okay. A highly effective and curated question bank with some 25,000 plus MCQs with their detailed explanatory answers have been prepared specially for you, right? Boost your medical preparation, students, with 24 months, that's 2 years of subscription. You get 4 months free, that's good. And with 1 year, that's 12 months, you get 2 months free subscription. Just remember this. Okay, and the 31st we are coming up with a grand test for our INI-CET students, the 31st of October. Okay, for the FMG students, we are coming up with grand test for our FMG students. Okay, and I'll tell you that now. These are our toppers. They have scored very well in the recent NEET PG exam, so we congratulate all of them. Congratulations to all of them. And raise a hand technique, in which, you know, there's an icon. If you press this icon, you can directly talk to the educator. And download the Unacademy app. Okay, fine. I come back to the slide, students. Come on, quickly tell me, which is the nerve of the first arch, the nerve of the first pharyngeal arch. If you can answer this, nerve of the first pharyngeal arch. So now students are getting confused in the nerves. I'll quickly explain this. Nerves of the first arch. Chalo bolo if you know. Nerves of the first pharyngeal arches. Mandibular nerve. Second, facial. Third is glossopharyngeal. Fourth, superior laryngeal nerve. And now the fifth arch is, now the sixth arch. Fifth arch disappear hota hai. Recurrent laryngeal nerve. Recurrent laryngeal nerve. This you have to know. Okay, this is extremely important, bacho. This you should know. So these are the nerves of the pharyngeal arches. Okay, these are the nerves of the pharyngeal arches. Okay, clear, students? Any doubts you have in this? You tell me quickly. Any doubts you have in this? You tell me quickly. Students, any doubts you have in this? You tell me quickly. Okay. Brilliant. Any doubts? So I hope everything is clear to you. Any doubts if you have, you tell me. I still have got 2 more minutes. So this 31st we have got a free grand test for the FMG students. This coming Sunday. So it's a free test, students. Come on, give this test, all of you. Let's crack it. Let's crack the test. Yes, any doubts? Nirupam, Sharad, Prem, Lenin, Dr. Rahul, Bhanu Prakash, anything else? Yes, Ajit. Any doubts you have, you can ask me. The session is open for discussion. I hope you've understood everything, and there's still, see, we generally take a particular MCQ and discuss the theory part, everything which lies around it. Okay, so there are many things which gets cleared simultaneously with the MCQ. Yes, thank you. With the with plenty of things, concepts will be getting cleared. See the slides, Pacho. The more you see the slides, no, the more you see the photographs, the pictures, the more you will be properly oriented. But your theory has to be very good to understand the slides. Be very clear with your theory part. If there's anything, any doubt, which if you're not clear about anything, you can always give me a okay. Vallicula ना, इसमें vallicula नहीं दिखता है. Vallicula is not seen in this बच्चों, but vallicula is epiglottis होता है. Epiglottis, ये epiglottis है and ये tongue है. हाँ, this is the epiglottis, this is the tongue. The epiglottis is connected to the tongue by 3 folds. 3 folds होते हैं. One is the median. इसको क्या बोलोगे? Tongue to the epiglottis. Glossoepiglottic folds. Glossoepiglottic folds. And there are 3 glossoepiglottic folds. One is median and 2 lateral folds होते हैं. One is the median glossoepiglottic folds and 2 lateral folds. And there are depressions like this between them. ये median, ये 2 lateral, and there are depressions which we call as vallicula. Okay, I'll show you this somewhere else. I don't have it here. So, ये tongue है, ये epiglottis है. Just remember the tongue is attached to the epiglottis by 3 folds. One is the median and 2 lateral glossoepiglottic folds. And the depression between them, ये 2 depression होंगे between the median and the lateral. This is known as vallicula. Okay, I hope students, all of you have enjoyed the lecture, understood the lecture, plenty of concept gets cleared. Thank you to all of you. Thank you. God bless you all. Thank you. So let us meet once again with some mixed bag like this. The intimation will be given to you. Okay. Thank you once again.